Good morning, good afternoon, and welcome to this Making Pharmaceuticals Digital Week webinar. My name is Vicky Chapman, and I'm the event manager for Making Pharmaceuticals exhibition and conference. Please do visit the makingpharma.digital website, www.makingpharma.digital, where you'll find information about the online hub, a section on white papers, and links to other webinars that we've already run. The on-demand files for Digital Week webinars will be available on here from the 3rd of November, as will this one that we're doing today. This webinar is from RSSL, and the speaker is Dan Nicolau, technical specialist in impurities. The presentation title is Nitrosamine Testing, Removing the Roadblocks. Daniel will be taking questions at the end of the presentation via the question and answer function, so please do feel free to put your questions in throughout the presentation and we will answer them at the end. I'd like to hand over to you, Daniel. Thank you very much. Sorry, Daniel, you just need to unmute.
Sorry. Good morning and good afternoon for those in different time zones. Thank you for joining me on this presentation. Hopefully it should be short and sweet, but I'm hoping that it should enlighten you on some aspects of nitrosamine testing. I'm Dan Nicolau, as Vicky has mentioned. I've been here at RSSL for some time working on a number of things, and in the last couple of years, obviously the hot topic has been nitrosamine testing, and so I've been developing the methods and sample preparations here in order to analyze for these nitrosamines in a variety of pharmaceuticals. And this is hopefully what I will discuss with you in order to understand what roadblocks are in this type of testing and where we go moving forward. So very briefly, RSSL has a number of services on offer. I'm just highlighting here very briefly on the ability for us to identify impurities, and this includes nitrosamines, unknowns, OOS investigations, and also including method development and validations. And because of the ability for us to be able to achieve these things, nitrosamine testing became a very natural progression throughout. So hopefully you all understand and know the history of nitrosamines in the last couple of years. But very briefly, in about 2018, there was a discovery of a specific nitrosamine in valsartan, which is a type of a sartan product, at a sufficiently high concentration that it was deemed important to remove it from the market. And as a consequence of all this discovery, the regulatory authorities have extended that investigation not from, or rather to all medical products and biological products in recent years, and they've set very specific deadlines. So for medicinal, for chemical medicines, there are other deadlines for biological products. There is a risk assessment deadline and a plan for any required analytical testing by the 31st of March next year. And then for all of that to be completed, including any changes to any processes, if required, by the end of September 2022. So there is some time, but unfortunately, because of the extent and scope of this, all the products need to be risk assessed, which for the international community, that is quite a lot. And for the pharmaceutical industry, this is requiring quite a lot of resources to be able to do this type of testing. And within that risk assessment, there is a lot of factors to take into consideration, including variations in manufacturing processes, different sites, different testing formulations, the lifespan of the product. Nitrosamines can form over a period of time, and it may be that within your risk assessment, you would need to look at nitrosamines over the span of your product. In addition, the nitrosamines may be formed in the presence of certain excipients, and therefore certain suppliers may need to be tested at this moment in time and potentially in the future. And there are a number of factors to consider when you're developing a method to looking for specific nitrosamines. As you can see here on the slide, I have a generic structure of a certain nitrosamine, and then I have some very generic nitrosamines that the regulatory authorities have identified as key targets in the majority of compounds. And you can see here that the toxicity of each of these nitrosamines vary. So in the case of the the first one, NDMA, N-dimethyl nitrosamine, they have a 96 nanogram per day safety concern threshold, and you can see that they will vary depending on the particular nitrosamine you are looking to identify and determine. Within your pharmaceutical product, the matrix is probably the most important factor to consider. Oral solutions with various excipients, solids, suspensions, all these factors will need to be taken into consideration in order to extract this nitrosamine or nitrosamines from your product. And hopefully this presentation will help you see some of the roadblocks that exist in this method development and sample preparation, and hopefully give you an idea on how best to get around them. Also, it's very important when you're doing this risk assessment to test or to determine what specific nitrosamines may be present. You may feel inclined or panicked to analyze for all the nitrosamines present. I know that the regulatory authorities have highlighted 6 specific nitrosamines, but there are countless species within that class of category that you may want to look for. So it's important to look for specific nitrosamines, because trying to analyze for all of them in your matrix will make that method development that much harder and that much more difficult and more time consuming as well. And then also, as you can see with the variation in safety concern thresholds, calculating that specific threshold for your product is also very important, because that will dictate also what analytical techniques may be most appropriate for your product. And then also looking at any chemical and physical characterizations will also help in developing this, this method specific for your product. And I'm hoping this presentation will enlighten you on some of those key parameters. Traditionally, there are a number of techniques that can be used for determining nitrosamines in food and pharmaceutical, and they include the GC-NCD, or nitrochemilucence detector, which is a very useful detector because it's very specific for nitrogen-based compounds, but may not necessarily be quite so sensitive, or your product may not be compatible in order for your sample preparation to be analyzed on that technique. And then also historically, nitrosamines have been analyzed by GCMS, both headspace and direct injection, and there are numerous published analytical methods out there that can be used, including sample preparations for a variety of products, including rubbers as well. So those are very key starting points in determining what method you wish to develop and how they are appropriate for your product. I know that the FDA in recent years have highlighted that because the thresholds in these cases are very low, there is a potential to artificially generate certain nitrosamines at very low concentrations, and they've recommended LCMS as an alternative to determining your nitrosamine concentration in your product. And hopefully in this presentation, I will focus mainly on LCMS. So LCMS is an excellent way to analyze for your nitrosamines for a number of reasons. And within the class of LCMS instruments, there are various varieties that could be used. In the case of nitrosamines, because you are targeting known specific compounds, a triple quad mass spectrometer is ideal for this scenario. And it is ideal because it is highly selective and incredibly sensitive. When we're looking at how low a concentration we can determine on these instruments, we can potentially go down as low as parts per trillion or parts per billion relative to the concentration of your API. And in conjunction with an HPLC or a UPLC, they are very effective in separating out various components within your matrix or your sample and determining the nitrosamines in the compound. And they are very robust and allow you to develop both quantitative and limit test methods. The illustration on the slide here, you can see, hopefully I'll explain to you the genuine importance of this triple quad mass spectrometer. So an HPLC is very useful in allowing you to separate certain species on the HPLC column, but sometimes they're not necessarily be possible. the mass spectrometer allows you an additional filter to make sure that you are looking at the very specific compound that you are wanting to observe. And it starts with the ionization of your sample. Traditionally, electrospray ionization, or ESI, is the main ion source that is used in LC-MS triple quads, and it works for a variety of compounds. Unfortunately, it does not work for nitrosamines, and APCI, or atmospheric chemical ionization, does work. It works incredibly well, and it is vital that you use APCI as an ion source moving forward. In addition, within the triple quad, you have a set of quadrupoles that act as mass filters. So when you're looking for a specific ion that's been generated in the ion source, traditionally what you tend to see is the nitrosamine plus a hydrogen being ionized. And we tend to call that in our nomenclature the parent ion. And in the first quadrupole filter, that parent ion can be isolated from all the other ions that have been generated in the ion source. Once that ion has been isolated, it moves to the collision cell, or Q2, where it can be fragmented. And those fragments will be very unique to that parent ion. And then in the quadrupole 3, or Q3, that ion, that daughter ion, or fragment ion, is then further filtered and then detected at the end. And this system allows you to be very specific in what you are looking at, and allows you to remove a lot of the background noise, increasing the sensitivity. And this parent to daughter ion transition is normally called an MRM transition. And you can get multiple transitions for each of your nitrosamines. And the secondary MRM transitions can be used as a qualifier to provide you additional confidence to ensure that what you are looking at really is the nitrosamine that you wish to observe. What I would say is that anything related to LC-MS, I would really recommend using an internal standard, specifically or ideally a deuterated equivalent of the nitrosamine you are looking for. This allows for so much better robustness, and any potential variation in recovery of these nitrosamines from your matrix, especially when they're a complex set of species, allows you to generate and validate a robust method. And when I'm not going to discuss in detail how to develop an LC-MS method and the parameters that would go into it. I think there are a number of published analytical methods for LC-MS triple quads available to you online. What I want to discuss with you today is the sample preparation. And there are a number of factors that are taken into consideration when trying to prepare your sample. And if you are very lucky and you have a very simple aqueous solution, a water for injection, for example, with a low concentration of API, there may be limited sample preparation required. But if, say, for example, you have a suspension or an oral solution with a number of complex excipients, high concentrations of sugars or cellulose, etc., it is important rather to be able to extract out your nitrosamines and remove those excipients, because they are not compatible on a mass spectrometer. They'll just make the instrument that much more dirty and far less sensitive, and then the method will not be robust, however good an analytical method you may have generated. And these factors will include the solubility of your excipients in API and the nitrosamine. Hopefully there's a very distinct difference and you're able to separate them out. There may be differences in the pKa, so you can utilize acid and base conditions in order to be able to use various extraction techniques to separate out the nitrosamines from the rest of the matrix. The concentration of the API is also very important. In my experience, I've had to look for nitrosamines at very low concentrations with API at 100 or even 200 milligrams per mil. And that is a very high concentrations that are really not compatible with an LC-MS. And then also the physical state. If you have a tablet, being able to utilize a specific solvent to be able to extract out selected species, including your nitrosamine, are very useful pieces of information to know. And there are various extraction techniques that we shouldn't sideline simply because of their how basic they may be. Things like filtering, centrifuging, and precipitating out are incredibly important techniques in order to extract out or remove certain excipients from your solution to be able to then analyze for those nitrosamines. And we all like the idea of using a solid phase extraction system because commercially you're able to attach, pardon me, attach an online SPE to an LCMS, making your analysis that much more easier and providing you a better high throughput. What I would say is, my colleague laughed at me that I like to utilize an old school type extraction system of liquid-liquid extraction. And I find that an incredibly important way of extracting out these nitrosamines, and hopefully I can explain that to you in this presentation. There are all the other extraction techniques available to you, and it's important that you keep those in mind when determining how best to prepare your sample for LCMS. And liquid-liquid extraction really is one of those important ways of doing it. You'll find that in literature, there are various sample preparations for nitrosamines going back to when they were first discovered as being toxic in the 1950s. I found a fantastic sample preparation for nitrosamines in rubber where they utilized liquid-liquid extraction using dichloromethane. And you'll notice that in literature that DCM is utilized frequently in extracting nitrosamines from various solid or liquid matrices. And this will just be an example. And utilizing that solubility difference. If, say, for example, you have a product where you have a high concentration of sugars, using dichloromethane in a liquid-liquid extraction is incredibly useful. The nitrosamines will move into the DCM layer while the sugars will remain in the water, thereby separating that unnecessary amount of sugar in your prepared sample. And the true real advantage of this is you're able to then easily concentrate up that DCM layer in order to meet what I would consider as very low analytical thresholds required for these nitrosamine methods and developing and validations. But SPE will also be an incredibly useful technique in determining, or at least extracting out these nitrosamines at very low concentrations. And there are various types of cartridges out there, silica-based, absorption-based, but again, depending on your sample itself, you can use a variety of analytical techniques, taking it, using a variety of SPE cartridges out there, taking advantage of the solubility and pKa differences. And you can see in the rather simplistic demonstration of a solid phase extraction that you're able to bind a considerable number of analytes onto the solid phase, potentially including your nitrosamines, and wash away all the excipients, leaving behind the nitrosamines. And then you're able to concentrate those nitrosamines from a high volume of your sample, thereby meeting or being able to meet the very low thresholds. And these techniques are incredibly important. I would like to provide you with all the details of a particular case study that I've experienced in the last year, but because of confidentiality, I'll limit the information that I have provided you. All I can say is that in this particular sample, there was an API which is very common in the industry, used for prevention of seizures. And what they were looking for wasn't the standard nitrosamine species that you can see in the regulations or guidelines, but they were looking for a very unique nitrosamine that they had potentially identified in their risk assessment. And it required a very low analytical threshold of 0.3 nanograms per mil in solution, in their solution, which is incredibly low, which is why LCMS was utilized in this case. In this particular solution, there was a lot of other excipients, including a very high concentration of sugars. And so in developing a sample preparation system procedure, I utilized this liquid-liquid extraction. A very simplistic system, but it worked incredibly well and very effective. And then by taking a proportion of sample and adding the dichloromethane repeatedly, we were able to extract out a very high percentage of this nitrosamine. And you can see there are a number of subtle aspects to that sample preparation on the slide. And they'll include diluting the sample with a little bit of water. We found that by diluting the water, we were able to increase the recovery. We used sodium chloride in the aqueous, which helps to better define the layers within that liquid-liquid extraction, but also encourages or decreases the solubility of the nitrosamine in solution, therefore encouraging it to move to the DCM layer, again, increasing its recovery. And all these little parameters and factors were optimized in order to make sure that we were able to generate or observe this nitrosamine at this very low threshold. In addition, as I described earlier, we were able to utilize the concentration advantage, where we initially used 1 ml of sample, but the final solution volume was only 0.5 mils, therefore concentrating the nitrosamine twofold. I would have liked to increase the concentration factor greatly, but even though we were doing a liquid extraction and the sugars had been removed, there were a number of other species that were transferred to the dichloromethane layer, and any increase in concentration factor only increased their concentration and decreased the response of the nitrosamine on the instrument. And it's important to remember that when you're doing this type of sample preparation, matrix effect on an LCMS is always present and should be taken into consideration. Utilizing the HPLC column and separating out as many of the species away from the nitrosamine is incredibly important to ensure that you are able to get the highest ionization in your MS. If you're unable to do that because you have an excipient or an API, in this case the API overlapped, it may decrease the sensitivity of your instrument. As you can see in the results that we were able to generate, we had a standard at 0.6 nanogram, now the new threshold, an unspiked sample, and then two spiked samples rather at two different concentrations. And you can see that we actually were able to find that this nitrosamine, unique as it may be, was present in their sample. And you can see that there are various differences in the peak heights. What we were able to find was that although we weren't able to determine or at least achieve 100% recovery, we were able to use this information to at least understand how much nitrosamine was present in relation to this specific threshold. So in this case, we now moved on to a quantitative method in order to exactly determine the concentration of this nitrosamine at various points in their sample lifespan. So I hope in this presentation that you found some of this information useful, and thank you for joining me. And if you have any questions, please do write them in the box. Thank you.
Perfect. Thank you very much, Daniel. Please feel free to add questions now into the question and answer. As Daniel said, down the bottom there will be a Q&A section. So we have got a couple of questions in there already. After this session is finished, please feel free to visit the makingpharma.digital website, where you'll find information on the online hub, on white papers, and links to on-demand webinars, which we've already hosted. So Daniel, a couple of questions for you. So yeah. Alberto has asked, are there any use to get information from excipients alone, given the numerous steps / interactions / sources / storage conditions, etc., until the finished drug product form? Thank you very much.
I'm not sure I quite understand the question in terms of information from excipients. My apologies if I misunderstand, and please email me if you have any other further questions. In regards to this, I think I'm more concerned here about how these excipients may interfere with extracting out these nitrosamines or interfering with the ionization of those nitrosamines on the system. Where those excipients may come from or their interactions, that would be focused more on the risk assessment and how they may potentially react in a way that could form a certain nitrosamine. Nitrosamines are normally generated by having a secondary amine and nitrites, or a source of NO, under very acidic conditions. So if you have those type of conditions and those excipients accentuate those conditions, they may be important to understand those factors. In addition to storage, we've also found that in some cases, under stability conditions, 25 degrees, 65% humidity, or even as high as 40%, 40 degrees, 75% humidity, we've seen an increase in certain nitrosamines simply because their formulations in those cases were ever so slightly acidic and had a high source of NO, nitrites, and a secondary amine in their API product. So just be careful with those type of interactions and those factors that are involved in risk assessing a certain product for nitrosamines.
Fantastic, thank you. We've had a couple of requests for your slides, Daniel. I think I'm safe in saying that if they email you, you'd be happy to share the slides, or they can then contact you with your email address that's on the screen at the minute, hopefully.
Yeah, and I'd be happy to discuss any issues or anything related to what I've discussed so far.
Fantastic, thank you very much. So we've got another question from Andrew. In the wake of Brexit, do you expect that there may be a rise in the presence of nitrosamines as a result of the use of contaminated raw materials in the API manufacturing process, if the UK does not remain fully aligned with the European Medicines Agency in the future?
Well, that is an interesting question. I shall try to be more scientific and not political in this. I don't see any detrimental issues in regards to Brexit. I think in this case, because it is solely a safety concern rather than a true quality statement, I think the UK will always be aligned in this regard. And in the case of nitrosamines, this is going to last for a couple of years, and it's certainly going to be at the forefront of people's minds in the pharmaceutical industry. I think going forward, though, understanding where your excipient, the source of your excipients, and also the source of your API around the world will play a part in understanding nitrosamine going forward. Just because we have a specific deadline that the authorities have provided us does not mean that nitrosamines thereafter are going to disappear. We are going to have to always look and understand the risk that nitrosamines pose in future products that are developed. And these sample preparation techniques that I've described, analytical methods, are going to be necessary going forward, irrespective of any change in political background.
Fantastic, thank you very much. We haven't got any more questions waiting at the minute. I'll just give it a second. So it seems like you've had a lot of interest, Daniel. So like I said, please do email Daniel if you wanted to get his slides from him, and he would be more than happy to communicate with you. This is also going to be on demand on the makingpharma.digital website. So you can visit that from the 3rd of November, and all of our presentations will be available from then. We haven't got any more questions. Again, please do contact Daniel if there's any burning questions that you have. But for the time being, thank you very much, Daniel. And thank you for watching this Making Pharma Digital Week.
Thank you very much.
Thank you.